Hello everybody, this is Dr.Bassam Salama. You are welcome to the first episode of Simplified Medicine. I thought between me and myself and how to present an easily digestible medical knowledge to the people. And I decided to take the initiative because lots of rumors are there on the Facebook, on the social media, on the Twitter, and lots of people who assume to be a doctor they are not, and they are spreading fake information for the good sake of selling their products. I want to confirm to everybody that I don't have any product to sell. I want only to promote for good knowledge. So please don't listen to the rumors. Don't believe anything if it is not referenced. And the topic of the day will be about Irritable Bowel Syndrome. I have seen lots of patients coming to my clinic and saying, Doctor, I have Irritable Bowel Syndrome. And they are actually overdiagnosing this syndrome. If you have some abdominal distension, bloating, or pain, or indigestion, it doesn't mean automatically that you have Irritable Bowel Syndrome, because doctors and scientists have agreed on certain criteria which should be there to diagnose Irritable Bowel Syndrome. I will explain it as simple as I can. It's an abdominal pain at least 1 day per week for 3 consecutive months, provided that at least 2 of the following conditions are met. Number 1, pain is related to the defecation. Number 2, pain is linked to a change in the number of bowel motions daily. Number 3, pain is associated with a change in the shape, texture, or appearance of the stool. So, if you have the pain beside 2 of the 3 conditions, you may be under the category of Irritable Bowel Syndrome after making the differential diagnosis. The doctor should differentiate this case from the following conditions. Number 1, celiac disease, which is intolerance of gluten. Number 2, ulcerative colitis. Number 3, Crohn's disease. Number 4, stomach ulcer. Number 5, esophageal reflux. Number 6, parasitic and microbial diseases of the gut. Number 7, lactose intolerance. Well, what are the laboratory and radiological examinations required? First, we start with the stool analysis, and then we go further for the occult blood in the stool. We examine H. pylori in the stool. We do breath test for the germs. We do X-ray of the abdomen, ultrasound on the abdomen, upper GIT endoscopy, colonoscopy, barium meal and follow-through, CT scan at the level of the diaphragm to know whether there is hiatus hernia or not, capsule endoscopy. These are all the investigations which aim at excluding the other diseases. After making sure that the radiology and the laboratory work are free from any sign, it is recommended to avoid foods that trigger your symptoms. You eat foods which are high in fiber. You drink plenty of fluids. You exercise regularly, and you get enough sleep. There are general medications which can be used for the treatment of Irritable Bowel Syndrome. The anti-constipation medications, the anti-diarrheal medications, the anti-cramps and anti-spasmodics, the painkillers, the anticholinergics, the normal bacterial flora available in pills or capsules, and it is called probiotic. And finally, antidepressants may be tried. There are some specific treatments for the irritable bowel syndrome, like iloxadoline, rifaximin, lubiprostone, linaclotide, and I apologize for not going through the mechanism of action of each of those individual medications, because this is a function of the doctor, and the purpose of this video is not to teach the doctors. We want to spread the knowledge among the ordinary people who are not medical graduates. Please do not accuse yourself of having irritable bowel syndrome due to a feeling of indigestion, bloating, or distension. There should be certain criteria for the diagnosis. My references are the Canadian Society of Bowel Research and Mayo Clinic. I hope that you enjoyed this video. Please like and share, and I wish you good luck. Wait for me for the second episode, which will be published soon. Have a nice day. Thank you. Bye bye.